Ready?
Waiting, not yet, no.
Oh, okay.
Waiting for a cue.
I'll wait for you.
Okay, thanks.
You wait for you.
Stand by.
All right. It's 6 foot. Small feet. Ready to go. All right. Good afternoon from Brazos County Health District. Thank you all for tuning in this afternoon for an update. An update that will go through a situational overview of where we are since we spoke last. A little bit of information today about a surge capacity plan. A lot of questions have come forth about that, and of course a lot of questions about schools. And so we thought it appropriate to reach out to let you all know how we're looking at things as of today, July 24th. I want to thank all of our collaborators today. Thank you to Sherry for coming by again to help us with communication. Judge Peters in attendance today, Mayor Mooney and Mayor Nelson both here, and want to a special welcome to Dr. Christy Whitbeck and Mr. Mike Martindale. Superintendents of both schools available today as well for questions afterwards. So let's get on to our situational overview and on to our talking points this afternoon. So as of today, there have been an additional 64 positive cases of COVID-19 reported to the Brazos County Health District. The total number of positive cases brings us to 3,635. The number of cases reported today is lower due to the holiday weekend. This is not an indication that we're seeing a decrease in cases as of today, but in general, I would say over the past week, we have seen numbers decreasing compared to those hundreds and 200s we were seeing previously. Total number of cases, as mentioned, 3,635. Number recovered estimated to be at 2,858. Active cases leaving us at 734. Number of current hospitalizations, 17. Brazos County residents currently hospitalized. And in the past 24 hours, we've had 3 discharged from the hospital. We are at 43 deaths, and that's 5 additional deaths reported over the past week. A female in her 90s who was at home, a gentleman in his 60s who was hospitalized, another 2 men in their 40s. One was at home and one was hospitalized, and another female in her 70s who was also hospitalized. We have testing numbers, 26,904 tests to date. The questions about bed occupancy, as of our most recent numbers, we're at 73% total bed occupancy. Those all patients, 73%. Total ICU occupancy is at 69%. This percentage, as we've talked about before, is very fluid, changes literally on the hour. Some questions about surge capacity. What does that plan look like? What are we talking about there? We've been talking about a surge capacity plan since March, well, even before that, but in context of COVID-19, really since March. The surge capacity plan includes what we would say internal surge. So the hospitals themselves would reach a threshold where they would surge. This is using areas of the hospital that are not typically used for hospital rooms, such as operating rooms or other areas of the hospital that are equipped to take care of patients safely, but they're just not typically used for that purpose. And then, of course, also reaching out to get additional personnel to come and assist. So that's all an internal surge. That has not happened to date. There has been no internal surge. That is the first step of any surge plan. Once an internal surge plan were to be tripped, or that threshold were to be met, then we go into a secondary plan which involves additional beds. These beds would be at Caprock, at the Physician Center, and also at CHI College Station. There are additional beds there. This, of course, would also include additional personnel, and so many mechanisms available to us to draw in extra personnel, healthcare personnel, to staff those beds. If then we went through that surge capacity to require even further beds, then we would be looking at alternate care sites, and so that would be the third stage. And of course, that would be a situation like they were working on in New York and widely publicized there. So I think the important thing here is there is a plan, daily discussions about this, and the first step of that plan has not been met, despite a pretty impressive surge of cases that we had about a month ago that we were able to make it through. So schools, lots of questions about schools. Schools are an important part of our community, as you all know, critical. They provide supporting learning environments, as well as critical services to students, such as school meals, social, behavioral health services. The Brazos County Health District has been working very closely with school districts for months, and even more intensely here recently, in evaluating plans and protocols for the upcoming school year that follow the most recent guidelines, the most current guidelines put forth by the Texas Education Agency. This guidance addresses things like on-campus versus virtual instruction, administrative activities by teachers, staff, students that occur on schools, campuses, or virtually, non-UIL extracurricular school sports and activities, and any other activities that teacher, staff, or students must complete that cannot be accomplished virtually. Visits by parents and the general public. All of this is in consideration of the guidance. The state of Texas, as of now, gave each local jurisdiction the authority to make decisions on school opening. I would really say delay a school opening if necessary based on public health situation. And to date, there has not been any guidance on how to make this decision or thresholds upon which to make this decision. I would say that, frankly, it was a bit of a surprise to me. About a week ago or so, I learned of this, and we have been in very close collaboration, since that time. And if this remains my decision, it won't be a rash one. It'll be evidence-based. We've been collecting that evidence now. We'll continue to collect that evidence. That evidence evaluates things like the effect of the virus in elementary school age kids, for example, on the community. It's not really well understood. We have some data from other countries that have continued to have schools open about what that looks like. And I can tell you that some of that data looks like kids do not spread the virus as efficiently as adults do, especially adolescents and adults. There is also a question about what about intermediate age school children and high school age children. Obviously, an elephant in the room and a big concern that I have and all of us have is that we will be welcoming literally up to 40, 50, 60,000 18 to 25-year-olds into this community right around the time schools would be opening. This would be around the mid-August timeframe. We know and we've seen what the most recent case surge that we had in the month of June was related to 18 to 25-year-olds. Now, I'll remind everyone here that was before masks were widely being worn, and that was before bars were closed. And we have definitely seen a decrease in the number of 18 to 25-year-olds impacting the coronavirus numbers in Brazos County. As mentioned, we continue to collect this data. Very interested in what that most recent surge did of those 18 to 25-year-olds and how that impacted our utilization. It's critical to know that because we need to try the best that we can to predict what our hospital utilization will look like in the month of September, in the month of late August, as more students are here. And unfortunately, no one knows the answer to that. We do the very best that we can to predict that. And the best predictor of that, of course, is what just happened. And so we're very interested in evaluating that data, and all of that's being done currently. We know that the vast majority of children who are impacted by COVID-19, who do get infected with COVID-19, do not develop severe illness. We know that for the longevity of this epidemic that has maintained true. So there's a lot to consider here, a lot to consider. And if this decision remains my responsibility, I will continue to be diligent. That diligence includes speaking with other health authorities throughout the state, which I've been doing, the commissioner's office, which I've been doing, and also with our local elected official leaders, and as well as with, of course, with our superintendents about what is being done and what is practical moving forward. A lot to consider, obviously. And so that collaboration is key. and that collaboration will continue, and I'm very grateful to the willingness of all of those who have been collaborating to date to continue to do so. And at that, we are to our question and answer period, and we are starting off with KBTX.
Hello, Dr. Sullivan. It's Haley.
Yeah, hey, Haley.
Hi. I guess my question is, at what point would a decision be made? Could this be made a week before school, or could it happen as school has already started and students are already in classrooms and may not have the resources to school online?
Yeah, so Haley's question is about when would this decision be made? And, even asking could this be made after schools were to start? That's not ideal. What we'd like to do is to, as I said, if this decision remains ours, is to make that decision before schools were to schedule start. What we don't want to do is start school and have to stop it because numbers are out of control. That's obviously what everybody's trying to avoid. But we have to remember that when we have 80,000 18 to 25-year-olds in this community, we can just only expect that our numbers are going to increase. What we really need to know is, are those numbers meaningful? Are those numbers going to impact our hospital utilization? Are those going to impact severe cases of COVID-19? We know that most 18 to 25-year-olds do very well with this disease as well. And so what's important to know is, how does it really impact our community? How does it really impact our hospitals? And that's the data that we need, and that's the data that we continue to work with. And that's what's going to be the platform of the evidence moving forward. And so we want that decision made before schools were scheduled to be opened, or available, I should say, to face-to-face or in-person contact. And so as I understand it, I believe we have a August 13th date for College Station tentatively right now. And so it would definitely be made before that, again, if this remains my decision. And but we will be diligent and remain to collaborate that, and a lot of work that we've already done and will continue to do to make this nuanced decision appropriately. Thank you, Haley. And on to the Eagle.
Hey, Dr. Sullivan, this is Kenny Wiley.
Yeah, hey, Kenny.
Hey, thanks so much. So I've got a question for Dr. Whitbeck and Mr. Martindale, and one also for you, Dr. Sullivan. So for Dr. Whitbeck and Mr. Martindale, if the situation requires at any point during the school year, is it your understanding about whether it'll be up to the health district or each local school district in Brazos County to close schools and move all students to remote learning? And I'd be interested to hear your perspective on that too, Dr. Sullivan. And also for Dr. Whitbeck and Mr. Martindale, talk to us, if you could, about your conversations with teachers and principals in your respective school districts about their concerns about safety, and just kind of help us understand the perspectives that y'all have been hearing to this point.
Okay. Were you both able to hear the question? Okay. Very good, Kenny. And I'll address my part, and then I'll leave the podium for the two superintendents. But what I'll say is that a lot of collaboration that we've been having, a lot of meetings that will continue. I have a tremendous amount of respect for both these superintendents, for their concern, for their care, for all that they're considering, as you mentioned, with teacher safety, with the student safety, and it's been an impressive task. And we have two excellent leaders who are up to that task. What I'll say, though, Kenny, is from with respect to the health side of this, and we have to remember that we kind of got to stay in our lanes, but then we got to communicate and stay in our lane from the health. And just today, the CDC put out its guidance with respect to schools, and I've had a chance to review it. I haven't had a chance to review it in the detail I like yet. As I said, it just came out today, but it's clear that when you look through that guidance, underpinning that is what is going on in the community. It is clear that the community effect needs to inform the school decision, and that makes sense. And as a matter of fact, it outlines different levels of community impact. And it goes through to include a sustained transmission that is uncontrolled. And we're not there. We do not have an uncontrolled situation. And we have sustained transmission in our community. Is it mild? Is it moderate? You know, you can get into these terms, and I'd like to see how they're defining that. But we have transmission. We're reporting our cases today, and we've been reporting our cases, but it's certainly not out of control. Our hospitals have been able to maintain, and they've been able to actually even maintain with their elective procedures, and we're making it. The big wild card, as I mentioned in my talking points, is that we have students coming in and we don't know that effect yet. So there's going to remain the collaboration in that respect from our areas, and I've been grateful to them for that collaboration thus far. And so I'll open up to whoever, Dr. Whitbeck, is going to come up first and speak to the second part of your question, Kenny.
Hi, good afternoon. In regards to the first part of the question, all districts are able to shut school down only if it is authorized by the local health authority. And that was a new guideline that came about just last week. So we do very much depend upon these conversations with Dr. Sullivan and others because we know that should we start and then have to stop again, that will be at their discretion. We do know, though, that we must provide virtual and face-to-face instruction. To the second question, I know that we would say probably our number one focus right now is our teachers, because in order to take care of the kids, you have to have your teachers there, they have to feel safe, and they have to feel as though the protocols are in place for them as well. So I know I have a teacher task force. We both have surveys asking them their preferences, and we're looking at all of that, looking at schedule modifications to allow teachers more time, and we're also even considering a calendar adjustment, perhaps in the near future, to give us a little bit more time as well for teacher preparation. So those are some of the things, but teachers are right now really number one on our mind and in our hearts in order to how to go forward.
I would echo much of what Dr. Whitbeck said. I think one thing that as we collaborate and looking, what we're looking for are thresholds that we collectively create to help us determine at what point would school closure be necessary. So those are items, or that information is something we will work with Dr. Sullivan in establishing. And in essence, hopefully that could be applied throughout the county with all school districts. As far as our teachers, our students, our faculty and staff, safety for everybody is the primary function. And as we establish our district level protocol and apply that to the campus level, as the campuses develop that, obviously they're getting feedback and direction from those people on campus, feedback from principals, from teachers. That is why we're requiring masks throughout. We are trying to put things in to mitigate the spread and help us manage this as we safely plan to reopen. We are currently penciled in to offer on-site and virtual as of Thursday, August the 19th. That's what we have down at this moment in time. However, I think we all realize, considering our circumstances, that one thing that is constant is change. So we will plan and focus forward and understand that might change on us fairly quickly. But the safety of all, the planning, the conversation, putting protocol in place, it is what we're focusing on at this point in time. And looking forward to establishing those thresholds for when schools would need to close due to infection rates or whatever markers that Dr. Sullivan and the health department would recommend to us.
All right, thank you. And if I could remind all of our media partners on the phone to mute if you are not asking your question. I think one of you is working on a home improvement project. That's impressive. That's multitasking. I'm impressed. We're on to KAGS, I believe, next.
Hey, Dr. Sullivan, thanks for asking people to mute their phones. I was about to do it. It's Gabriella.
Hey, Gabriella, how are you doing?
Hey, good. How are you? I've got a few questions, actually. First, you mentioned internal searches and what that all entails. How close is the area to that point where we would have to kind of enact those things? And also, what would be like the threshold of positive cases for closing schools or moving them online? And then third question, would there be a situation where some grade levels or some schools would close or move online and not others?
All right. Okay, Gabriella. So let me take a stab at these three. Number one was about the internal surge plan. How close have we gotten to that? And, that is, as we mentioned, the collaboration. That collaboration includes our healthcare administrators who have been Jason Jennings and Theron Park, the presidents of both CHI and Baylor Scott and White, respectively, who have been managing this throughout this process to maintain the capacity. And they've done impressive work and have not had to move to that internal surge plan. When we talk about percentages, earlier in the mayor's, or the governor's plan, there was that 85% that was there. But we have to remember that you could hit that 85% and be right back out of it an hour later. And so really what we need is a sustained capacity issue. And we have not had that sustained capacity issue. But that's what an internal surge would look like when we need to start, as I've mentioned, using non-conventional areas of the hospital to take care of patients. And that has not happened. Were we close? Nobody likes to be anywhere close to that, and we were worried, it might be a word there, that we might get close. But we have, in the context of our numbers improving in the community, we have correspondingly seen our numbers improve in the hospital as well. And so we expect that to continue. But we appreciate the cooperation of everyone in the community, especially the mask wearing and the social distancing that certainly we've seen the benefits of. With respect to the second part of your question, a threshold for closing. In my first read of this guidance was outlining what would have been called an uncontrolled situation in a community. Uncontrolled would mean that that surge plan that we talked about, not only had we hit that, but we're moving into the second part of our plan, where not only have we got our hospitals having to be creative, but we've had to move to using other hospital beds that are not being used at all. So that is, when that starts happening, that to me is uncontrolled. And so the numbers that would be leading towards that would be the concern. And so we need leading indicators of that, and that's where all this data comes from that I was referring to in the talking points of really knowing when is that going to happen in this community. And it has to do with which parts of the community is being impacted by COVID-19. As we mentioned, younger folks and those 18 to 25, as long as they're getting it, they're not really using our hospitals with it. They're not getting that sick for the most part, the vast majority. But the concern is, how much is that impacting the rest of the community, those who would be using those? And so we just had a recent surge, so to speak, that we got through, a recent peaking of our cases. And so I'm interested to know where that leading indicator led to that number. And so that's what we're working on identifying. And those are the types of things that we would need to look at with respect to closing down schools. Really what we'd say there is moving to a virtual format, might be the way of saying that. And it's happened again, Gabrielle. I can't read my writing again. I have something about grades. What was the third part of your question?
Basically, would there ever be a situation
grades.
where
Yeah,
some
okay, yeah.
grades would have
There
to
you go.
move
Yeah.
online?
Thank you.
Yeah.
Yes, and that's a good question, and it's an important consideration, right? We just got done talking about the different risks. That study that I had mentioned, it was in the CDC publication, MMWR, that was outlining South Korea. It was an interesting study that looked at index cases. So those who have the disease, who did they spread it to? How many people did they spread it to? And interestingly, kids, especially less than 10, they're not very efficient spreaders of this. Not only do they not get it very efficiently, but they don't spread it very efficiently. And so you'd look at that and say, well, elementary schools, if they're not going to be spreading it. The other thing that we look at, Gabriella, is that little leagues have been going on. Granted, that's outside, it's not in enclosed spaces, but we just haven't seen a lot of kiddos with this in Brazos County. And so is that different from high schoolers? High schoolers who are getting closer to that group that we know spreads this virus very efficiently, and that's our older adolescents and our young males, or young kind of into the 18 to 25-year-old age group. And so, really that's the consideration. You think of everything like a spectrum. There's, as we get closer to this age group, there's likely more efficient spread. The younger folks don't seem to spread it as easily. And so to your question about grades and the way that we would look at that, I think we have to look at this. We have to make a smart decision here. If we ultimately are making this call, that would make sense and that would follow the evidence in front of us, because a lot to consider, as we mentioned. Thank you, Gabriella. And on to WTAW.
Thank you, Dr. Sullivan. Bill Oliver here.
Yeah, hey, Bill.
A question for the elected officials, the mayors, and Judge Peters. Also a question for you. Let me pose the question to the elected officials and let them consider a response. And this deals with the budget season that has now begun and how the cities and the county plan to fund the Brazos County Health District, considering we're going to be going to a first full budget year, not only with this pandemic, but West Nile virus has started reports around the state. Of course, we have the flu season coming up next winter, and then all the remaining health district operations and the past requests the health district has made for building repairs and other capital expenditures. I'm curious what the mayors and the county judge can respond to keep the health district properly funded. The question for you, Dr. Sullivan, goes back to testing. Took a look at the last few weeks of the number of tests that have been administered in Brazos County, and noticed in the week ending today, the number of tests that were administered were about 1,600. That compares to a little more than 2,000 last week, and then 2 weeks ago there were more than 3,000 tests administered. And that got me to wondering what those numbers may mean if there are fewer tests that are being administered over the course of July.
Mm-hmm. Yeah, and let me answer the testing question, and I'll turn it over to our elected officials with respect to your budget question, Bill. The testing thing, really, to this point, has a lot of it's been reflected on those presenting for care. One of the numbers that we track is how many over the past 24 hours have shown up to emergency rooms. It's something else that we try to look at. We do the best we can to get that indicator. It's not a perfect metric, of course, but that number is decreasing. So what we know is that less people are presenting to urgent cares, to emergency rooms for testing. They're with symptoms. Anybody who presents with symptoms should be tested. And so ideally, when we have a broad amount of tests available, we're also able to test close contacts at the appropriate time. We've talked about that previously. You don't want to test right then. You want to test about day 5 from the time of that contact. But if we're able to test all of those individuals, then we see a lot of tests being done, and we see lower positivity rates. So that's how those two things stay in tandem. And the testing, I'll put it this way, the broad testing that we would like to do with respect to getting that positivity rate down, that's still a challenge. That's still a challenge logistically. And we're not where we would like to be with respect to availability of tests, here and there. We're doing okay. We're able to get those tested who need to be tested, who present, but as far as being able to test all of the contacts around them at the appropriate times, that's become more of a challenge. And so I think that's the trend that you're seeing there, Bill, is that less people presenting and still the strain on the testing system that we have to acknowledge. And
I
so,
also noticed in those 3 weeks that the positivity rate's been hanging in there between 18 and 20%.
You're exactly right. Yep, and that's referring to that second part I was saying, that if we can continue to get those tests, if we're only testing people who show up with COVID-like symptoms, our positivity rate is going to be very high, because we're only testing people who have the disease right in front of us. There's a lot of COVID going around and folks showing up with COVID-like symptoms. But if we are able to test those who are at risk for that, we want to see if they're developing symptoms. That's what drives down that positivity rate. And so I think we've seen that really nationally, that positivity rate has increased, and that's really what that reflection is that we're testing those who are presenting with symptoms. And so, all right, and I'll turn it over to look like Mayor Mooney's going to come up and answer the second part of your question, Bill.
Howdy, Bill. As you know, in College Station right now, we're about to have 3 days of workshops on our budget for the 2021 fiscal year. And of course, a part of that is what amount we're going to fund the Brazos County Health District. And there is discussion that's ongoing. Certainly, we're aware of the additional costs, but we're also aware of some of those costs and how they've been covered by some of the federal aid that has come through. So to give you a hard and fast number right now is a little bit premature, but I do know that all of our representatives from the county, Bryan and College Station, are all gathering, as they have been now for several weeks, trying to come up with what will be the final decision when in College Station as we finish our budget workshops on Wednesday. Okay.
Also interested in getting observations from Mayor Nelson and Judge Peters.
Yeah, Andrew's on his way.
Hi, yeah, Bill, I would echo what Mayor Mooney said, representing the city of Bryan. We are on Tuesday going to start our workshop. So, I mean, it's the right time of year, so it's a timely question, other than maybe asking us next week when we've been able to deliberate. Our staff will have time to provide that information to us. We'll see the request from the health district, which is working there. Our mayor pro tems are on that. I know for the city of Bryan, we've also got Councilman Buppy Simek, and in addition to Mayor Pro Tem Greg Owens. They're doing a great job. They've been helping. You know, we had Operation Restart, where the health district helped us through that. We've got the contact tracing. There's a lot of things that that the health district has been doing, working overtime, and we really appreciate all the hard work that they've done. So certainly will not be shocked if there's a request for more funding than say we've had in the past. And you know, I think we just need to allow our staff and the health district to crunch their numbers and to present that to us, and I look forward to hearing that. But certainly appreciate all the work they've done, and I know none of this is free. Judge.
Hey, Bill. We're all working through all our budgets right now, and so I agree with the others. We're not ready. I don't think any of us are ready to declare what the budget for the health district will be next year. You know, everybody's struggling with all the things that, you know, we're seeing in the future about how we're going to maintain, you know, the services that we've been providing, and so we're dealing with it right now. And hopefully that we'll be able to deal with the health district to maintain the kind of things that they've been doing. And I mean, they do a great job. So, you know, we're still working through it, Bill.
Thank you.
All right, thank you, gentlemen. Thank you, Bill. And on to the battalion.
Hello, this is Julia Potts.
Yeah, hi, Julie.
Hi, I just have one question for you. So A&M Transportation is taking precautions such as reducing bus capacity to 50 to 60 people. But even with face masks on, how safe are students from COVID-19 in situations like this where social distancing isn't always possible?
So it's a good question, Julie. At the end of the day, it's about space, it's about ventilation, and it's about being around those who have it. Right, those are the factors. And so as we look at those areas that are cramped, that we're not able to get that distancing, and where we have others who have it, that's a high risk. The longer that we're in that environment, the more we're at risk. And there's been a lot of studies that have tried to quantify that, tried to say it's this many minutes. But what we know is that it's really difficult to do that. And we've talked before about what we call a primary contact, and that contact comes from somebody within 6-foot radius for greater than that 10 to 15 minute radius. You've seen a couple definitions there, or 10 to 15 minute period. But so if you're on a bus with somebody and people are not wearing masks, and you're sitting close and you're on the bus for longer than 15 minutes, then that is a high-risk situation, especially if we don't have windows down and because we don't have ventilation there. So trying to maintain that distancing within the bus, and I know that the transportation companies have been trying to do that, and the masks are critical. The masks do help. They help especially in a situation like that. So if we can maintain that 6-foot radius and be wearing masks, that makes that environment safer. But we see a gradation of risk for lots of different activities that are out there, and a packed bus is definitely high on that risk. And we saw that also with the the subways in New York, and the reason why those have been shut down for so long for that same reason. It's a cramped situation, and you're very close, and there's not a lot of good ventilation, unfortunately, down there. So thank you for that question. And on to KXXV.
Hey, Dr. Sullivan, it's Hallie. How are you?
Yeah, hey, Holly, how are you doing?
I am doing well. I have a few questions. First, the question that I have is whether or not our hospitals, how we're doing in terms of staffing, if a surge plan were needed down the line, just wanting to know how the staffing is in both hospitals. And then in regard to the school district, obviously other health districts have pushed in-person learning back to after Labor Day, and just wondering if that would be the date if you guys were to make a decision before August 13th, if that's the date you'd be looking at, or if Labor Day, that holiday, doesn't necessarily play a role in that decision. And then my third question is, does the health district, would you guys recommend Texas A&M to require COVID testing for students, faculty, and staff before returning to campus at the start of their semester? I know there has been universities across the country, up in Waco, Baylor has decided to mail out COVID testing, so I just wanted to know whether or not the health district would recommend that to A&M.
All right, so thank you for those questions. So the first part of your question, Hallie, was around staffing. Staffing has been tough. Staffing's tough for a couple reasons. One is just as we see more and more patients, it's a challenge. It's always a challenge in healthcare, but it's a particular challenge now. And then we also have individuals who are either do have COVID, and we've had a few, or are at risk for that. And so there's some absenteeism that has happened there. I will mention, I think it's important to mention, that we have been taking care of COVID patients since March in hospitals, and we have not had a lot of COVID disease in our hospitals, in our staff, because we have been wearing masks since then, and we have been abiding by these principles that we discuss, and we're obviously used to that in healthcare. But I think that if there's anything that's demonstrated the effectiveness of these measures, we could say that they're in hospitals, and that applies to other settings as well. But to get to your question, staffing, is tough. And staffing's always tough in healthcare world. But what I'll say is that if we had to go to a place where we were surging, that would need to involve bringing other staff in. Whether it's through temp agencies, whether it's even through federal or state help, we would need to bring in extra healthcare personnel if we got to that situation. And we do have plans in place for that. Second part of your question was about the health districts so far that have recommended pushing to a after Labor Day. I think after Labor Day is just neat. It's kind of after a holiday, and I think that's where that comes from. But the other thing that does is it gives 2 extra weeks. And the issue with 2 weeks, we've talked a lot about 2 weeks. 2 weeks is the incubation period. It's a time when we really see the effect in the community from an intervention. And so those 2 weeks are just 2 more weeks of data and to assess a local situation. So if you have a local situation that's uncontrolled, high risks of sustained transmission, there's a lot of rather demonstration of sustained transmission and it's uncontrolled, you would want to put something in place that decreases that. The governor put 2 things in place during the middle of our high cases, and that was the masks and and closing the bars. And those 2 things happened pretty simultaneously, but sure enough, within 2 weeks, we start to see our cases drop down. So that's where these 2-week chunks come from. But I don't think there's anything special about the Labor Day otherwise, other than, of course, that's any time we have a holiday. We had a bunch of holidays this summer. as we always do, and those holidays do pose an extra risk for transmission. And so if we were looking at in some way delaying the person-to-person component of school, that makes as much sense as any other date. And then with respect to the third part of your question, would the health district be asking or recommending the university to require testing of all individuals returning? You know, we have to be realistic with any recommendation that we make. And we've talked about Bill's question. You know, we talked about testing limitations just with day-to-day things. Those limitations still exist, and as I mentioned, we have to be real about that. And we're talking about I believe when all students are in town, it's in 80,000 when we're talking about Blinn and College or Texas A&M not coming into College Station and Bryan. So that would be a whole lot of tests. And we've also talked about the limitation of those tests as well. And so, no, that's not a recommendation that I would make. I don't think that's practical. I don't think that's something that we could follow. I don't think that's something that we could track. I think what I would recommend that we do is what's been set up is that we have good messaging, good education, that we also have an ops center which has been set up to be able to find cases where they are and then to trace them. And that has already been set up, that ops center, and is working, and we're working on getting that staffed right now, and that's a critical piece to this new dynamic of the students coming into town, and that is important, and as I said, is up and running. And so there we go. We got through all the questions. We're grateful for our media partners again to helping us out, get the word out. I know there's been a lot of questions since our last press conference, and we wanted to come before you today. One, to thank publicly all the collaboration that's occurring and will continue to occur as decisions like this are in front of us. And thank you all. Have a wonderful weekend. Please be safe. Thank you, Sherry.
I was like, I wasn't sure if that changed since we went there. Haley's finished, she's about to come in there, she's doing the story, so I don't know exactly. You did such a nice job. Thank you.